Hello everyone, this is Vincent Obita and welcome today. Now for this session we are going to cover one of the silent stations that have been introduced in the new test of competency, and that's the oral care plan. You can have 4 different scenarios, but for this case we are going to cover oral care plan for patient who is in critical condition, that is critical care patient. Now, for this scenario, one thing that you have to recognize is this is a patient who is using a ventilator in their breathing, and they have the endotracheal tubing connected to a ventilator. So that's where your focus should be, because despite the 4 common points, there are going to be 2 specific points that are attached to this particular patient, and for you to get the full marks you need to have all those 6 points as required by the OSCE marking criteria. And this is the easiest way to master all that. What you'll need to do is, since this patient is critically ill, they're not able to swallow any saliva or anything, so all the secretions are coming, and that's why they need the oral care frequently and regularly. Now, in this case, the 6 points will commence from twice daily cleaning of the teeth using a suction toothbrush or just saying soft toothbrush. That will do. The second point will involve twice daily chlorhexidine mouthwash, to prevent to reduce the risk of ventilator associated pneumonia, that is VAP. Then the third point will be the aspect of use of oral moisturizer on the oral mucosa and the lip balm every 2 to 4 hours. Okay, then the fourth point, which is a general point for almost all the care plan, is do reassessments every 8 hourly. Now, there are 2 specific points for this case. One of them will be the aspect of doing oral suctioning, to prevent the aspect of aspiration, because these patients, the tubing has gone all the way to the airway and they're not able to swallow, and in this case they are at risk of aspiration. So there's also use of oral suctioning to prevent aspiration. Then the last point, which is still related to this case of having an endotracheal tube, will be minimizing traumatic ulceration that is caused by endotracheal tube, by changing it from side to side. So if it was on the right side, it will be moved to the left in the next cleaning, and also use of bite blocks. So your statement would be reading like minimizing traumatic ulcerations by changing the endotracheal tube from side to side, as well as use of bite blocks. These 6 specific points will gain you full mark for your oral care plan for a critically ill patient. Remember, you may be given a scenario, so and so had this situation and is currently in critical care unit and is now having endotracheal tube, and you are the one who is supposed to identify that this is a critical care patient that need such form of care. So based on the scenario that you will be given, ensure you identify it correctly and give you all those points. Sorry for that. Now, what you need to take into account as well is the aspect that that this is a silent station. You need to cover all those points. Thank you very much and take care. Bye.